Welcome back for this Thursday's Panhandle Health interview segment. When it's over, you can take part in a chat about it on connectamarillo.com. The subject this week, HPV, the human papillomavirus, and a vaccine called Gardasil. And with me to talk about it is Dr. John Young from Panhandle Pediatrics here in Amarillo. Dr. Young, thank you very much for being here.
Thank you.
Lots to cover. First of all, what's HPV and what's Gardasil supposed to do?
Okay. Well, human papillomavirus is a group of about 200 viruses, and a small number of those cause some very serious complications for people. For example, a number of them, including number 16 and 18, which are protected by Gardasil, are able to cause cervical cancer, vaginal cancer, vulvar cancer, and even penile cancer, throat cancer. So a number of issues that come up later in life that would be nice to protect children against now. The HPV vaccines, which there's two of them, Gardasil and Cervarix, are both the first real anti-cancer vaccines that we've had, certainly for the pediatric population, to try to prevent complications later in life.
And we've heard a lot of horror stories about Gardasil, side effects, unexplained deaths. A couple of years ago, we're coming out with a report on that. Is it safe, and would you still recommend that a daughter, say 12, 14 years old, get this vaccination?
Well, certainly the FDA has been reviewing this very carefully to look to see if those deaths could be attributed to Gardasil. Every one of them that they evaluated has not been tied to it directly. They've looked at other side effects and looking at populations of children who weren't vaccinated versus the children who were vaccinated, and have not found any significant differences except for local blood clots, and that it may cause some of the girls or boys who get it to pass out. There's fainting associated with it. So generally considered to be safe. There are a number of websites. It would be very difficult for patients to go surfing through the internet and taking a look at sites, because it's very difficult to tell based on those what's actually verified, what's not verified.
What age do you recommend the girl get this vaccination?
It's approved all the way down to 9, but I generally recommend it any time before sexual activity begins. Most of the families are doing 12, 13, 14, etc. I think when the patients and parents are looking at this in terms of whether they should give it to their daughter, it's good to look at names and people that you can trust that would not have any real association with Merck vaccine or the FDA. For example, Boston Children's Hospital, Johns Hopkins Hospital, Mayo Clinic, infectious disease and community health from those institutions has come out very much in favor, and especially St. Jude's Children's Hospital. They treat cancer. They know this, and they're very concerned that the patients that they have treated in the past are not receiving this vaccine, in fact less than 50%, and they're actually doing a study to find out how they could best help their patients to get that for their children.
So much more to say. I'm sorry, Dr. M, but we're out of time right now. If you still have questions, though, in a minute or two, the doctor will begin a chat on that topic. To be part of it, go to connectamarillo.com and click the Alert tab. Thank you once again.